right, so we're going to pick up where we left off. After narcotics, just roll right into the other ones. All right, so stimulants. Stimulants are ones we have talked about already. ADHD drugs, so Ritalin, Adderall, those are stimulants. Nicotine, caffeine, those are stimulants. Cocaine, speed, meth, those are all stimulants. So increased feelings of well-being, energy, and alertness while suppressing appetite can be followed by depression because you're giving yourself those large amounts of dopamine, and then your body will stop making that dopamine. So you go into a big dip of no dopamine. Dopamine is one of the things that makes us happy. So you tend to have depression after stimulants because it gives you such an increase of dopamine. Tend to be highly addictive because you want the more dopamine. Used to treat narcolepsy and ADD. So we do use stimulants for different types of diseases. Also includes nicotine and caffeine, which I said. So once a stimulant wears off, severe depression usually sets in, requiring more stimulant. That's kind of where that addiction cycle goes on. So amphetamines, which is speed, methamphetamines is just another version. Cocaine, remember crack cocaine from the video yesterday, are the same plant, just different ways of taking in the drug. And methamphetamine. So those are like the ones we think of as being like the illegal drugs that are stimulants. All of them are going to be raising your heart rate. Okay, so basically the end result, if you were to overdose on these drugs, is a heart attack or a stroke, things related to those things. It raises your blood pressure, raises your heart rate, body temperature, all those things that go with extra energy, extra stimulant, just like a stimulant would sound. It raises your heart rate. So a little bit about methamphetamine, mostly just because I feel like this is like the most common drug around here. As a heavy drug, so meth. When I talk about it, should not do these videos at the end of school day. I always yawn. Produces effects of similar to crack cocaine, but the effect of it lasts longer. So I guess y'all weren't here, so I probably didn't talk about this because y'all are at home. So when we watch the cocaine video, something that I always bring up is that the reason why cocaine is more likely to cause an overdose than meth is because meth lasts longer in your system. You'll feel that high longer. Cocaine is like 10 minutes. So a person who is a cocaine addict is going to take it 10 minutes later is going to want to go take more. So it's just more likely for them to overdose during the night of them partying and taking more cocaine. Whereas methamphetamine lasts longer. Once the effects do wear off, the users tend to sleep for days. It kind of makes them crash. So just because they are not taking it as consistently, it is less likely for them to overdose. Not that you can't. You absolutely can overdose on methamphetamine. It's just less likely than cocaine because of that reason, because of its longevity. So that is why a lot of times they'll say like the average lifespan of someone who does cocaine is 5 to 7 years if you're a true cocaine addict and you're doing it a lot. Whereas meth, you may even know people, have heard of people who, 20 years been doing meth and they're still alive. They're messed up. They've messed up their body. Lots of things they have issues, but they have not overdosed. And it's just because of that longevity. Here's some meth teeth, just for fun. Law enforcement agencies across the country are hoping to get a message out to young people that meth takes a terrible toll on their body. Because again, the reason why the other drugs are not like meth mouth, like that's what people say. It's not that cocaine and heroin and things like that don't hurt people's bodies. They absolutely do. It's just that people tend to die before their bodies look as bad. They tend to overdose. Those drugs are so dangerous that they tend to overdose before the effects have fully taken on their body as much. Whereas meth, again, a lot of times they don't overdose, so it's giving the drug more time to affect their body. Meth mouth. Here's some transformations after using heroin, cocaine, alcohol, and meth. They're all not a long time in between the two photos, so it definitely takes a toll on your body. All of these things we call drugs are poisons. Like that's what they are. All right, anabolic steroids. So this is still in our drug category. Synthetic compounds chemically related to testosterone. That's what they do is they mimic testosterone, which helps our body produce more muscle growth. Promotes cell and tissue growth and division. So popular with weightlifters, bodybuilders, and other athletes, using to increase bone mass and body muscle. The side effects can include acne, increased body hair, baldness, high blood pressure, high cholesterol, impaired fertility, in males, blood clotting, heart attacks, and certain types of cancers. It's not good for you, okay? It's not. So you can be prescribed steroids for certain reasons to get over certain things. That's why it's a controlled substance, not an illegal substance. But it is not good for you, especially for people who are still growing. You should not be taking these things if you are still a developing person. So anabolic steroids are bad for the heart. They can increase fat deposits in the blood vessels, which can cause heart attacks and strokes. They may also damage the liver. Steroids can halt bone growth, which means that a teenage steroid user may not grow to his or her full height. So they may be thinking, I'm taking steroids to make myself bigger, but it actually makes them not grow as much. This is something that tends to happen with people who have to take a lot of steroids for certain diseases like asthma. A lot of times that you get you inhale a lot of steroids to help with your asthma. A lot of them don't reach their full height of what they thought they were going to be originally because of those drugs. Here's just some things it can do. Brain cancer, depression, violent behavior, yellowing of the skin, bad breath, severe acne, heart attack, stroke, development of breasts. It actually can make men grow breasts, and breast reduction in women. Odd. Liver tumors, nausea, vomiting, kidney disease, abdominal pain. In men, testicular shrinkage and impotence, which means you can't have sex. Okay. In women, irregular menstrual cycles, bruising, infections from injections, stunted growth, weak tendons. So it affects your whole body. All right, moving into depressants. So this is our last category. So depressants are substances which slow down the normal function of the central nervous system. That's why they are called depressants. So they're lowering your central nervous system. They cause drowsiness and slowed brain activity. They relieve anxiety and produce sleep. Side effects can include slurred speech and loss of coordination. Overdoses are slow heart rate and breathing and have a potential to induce into comas. And then in that coma, it's kind of like you stop breathing, slows your heart rate enough that you die. Mixing depressants with alcohol and other drugs increases the potency and health risks. So these include barbiturates, which are just another kind of medication, Valium, Xanax. These are all depressants. Rohypnol is a date rape drug, makes them pass out. So anything like that, these calmers are depressants, and alcohol is a depressant. So depressants versus stimulants. So slows messages between the body and brain. Stimulants creates fake messages in the brain. Signals from eyes and other senses reach the brain very slowly, so like slow reactions. Blood to skin decreases, the body is less able to cool itself, so overheating risk. Your heart rate drops in a depressant, leaving the body with less energizing oxygen. Breathing rate decreases, risk of lung infections. Messages to the muscles are slower, arms and legs can't move as well. The body can't sense or respond to danger quickly. Whereas the stimulants, the heart rate speeds up. Instead, the liver releases sugar into the blood, reducing the body's energy storage. Result, if real stress occurs, the body won't be able to respond. Both bad, just different kind of bad. So depressants, this is just the date rape drugs page. Rohypnol, Ghb, ketamine, there's other ones. I just want to bring this up. I mean, a lot of you are going to college. It actually is still a really big issue in colleges today. It's this being a party drug that people put into people's drinks. So please be careful, whether you are a boy or a girl. It does happen to both. You won't notice it that's in your drink. It will dissolve, okay? So don't drink at parties like that. Usually they get a name for themselves. Usually you will know which ones on campus tend to do that. Don't go there. Don't risk it. And certainly don't drink things that people give you, that people have tampered with, that you have not had your eyes on all the time. Because I feel like it's like, it's such a hush-hush topic that we pretend like it's not really happening. It happens all the time. Like it's way too common. So Rohypnol is a date rape drug. That like the number one they use. Rohypnol is a fast-acting drug as it only takes 30 minutes to start to work, while it can last for 18 hours of you being passed out. Causes confusion, dizziness, lack of judgment, and drowsiness or loss of consciousness. When Rohypnol is mixed with alcohol, there is a higher risk of overdose, so sometimes they die. difficulty breathing, or even death. Okay, so it's not good. All of these are made worse with alcohols. Let me think. Yeah, I'll talk about alcohols. I'm going to stop. So, alcohols are a depressant, but they're also kind of like their own category because they have a specific way they affect their brain as well. All alcohols are toxic to the body, can damage the liver, alter behavior, and depress the central nervous system. So, being they're depressing the central nervous system, they are a depressant. Alcohol is absorbed to the stomach and the intestine, oxidized in liver, excreted by breath, perspiration, and urine. So, all of those locations you can look for alcohol if we're testing for alcohol in someone. Okay, 18,000 of 44,000 annual traffic deaths are alcohol related. That's a pretty big chunk of them. Related to, and send over 2 million people to the hospital every year. Okay, so it's a huge issue. It's like the number one reason that a lot of teenagers will die prematurely is underage drinking, driving, crashing. 112 million times a year, alcohol impaired drivers put you at risk. It happens constantly. Be careful while you drive. Alcohol affects your entire body. It does. I know that it's a really common thing. I know that probably many of you have several people you know that drink. It's one thing to say that you're going to be a grown up and you're going to be legal and you're going to have one drink. It's a different thing to be going around getting super trashed and driving in a car, or being super trashed around people that you don't know and you don't know what they're going to do when you pass out. You don't know if they're going to help you and you're going to drown in your vomit. It's very dangerous. Please be careful. So drugs of abuse, these are just kind of listing them. You have this chart. I posted the notes. So like if you were in class, it would just be on your note packet. But this PowerPoint is posted. If you want to look through it, it just kind of tells you all of the information about it, what it can do, what the overdose would be like, the duration of the drug, how high, how much is it likely to cause addiction, things like that. So just kind of whole long list. And that's where we're going to stop. So we've went through all the normal classifications of drugs.